Welcome everyone. My name is Alana Maynor and I'm the Executive Director at Rural People's Voice. We're excited to be holding a press conference here today in Three Rivers Hospital. We'll be talking about how the big Medicaid cuts and big cuts that have come from the federal government are impacting us here in Okanogan County. So our speakers, you'll hear first from Scott Graham, who's the CEO of Three Rivers Hospital, then Amy Ellenson, the Clinical Medical Director here at Three Rivers, followed by Josh Corsa, the ER Director at Three Rivers Hospital, and Rena Shaver, the Executive Director of Community Action Council in Okanogan County, and David McClay, the Executive Director of Okanogan Behavioral Health Care, and then I will come back and close for us. It's my pleasure to introduce Scott Graham.
Thank you, Alana, and it's an honor and a pleasure for me to be here to speak about this important topic. Three Rivers Hospital has been in this community since 1949. We have been here to serve all of the patients, all of the community, to make sure that they got the highest quality of care, the safest care. And many of the folks who come here depend on insurance, and specifically there are many who are relying on Medicaid to be able to cover the costs of the care that they receive. And we've been happy to serve them. We are really unhappy about the change that took place last week with the legislation that essentially guts Medicaid for the care that we provide. Cassie Sauer, who is the CEO of the Washington State Hospital Association, summed up the legislation as the worst piece of legislation in her memory. This has been a devastating turn of events, and will have far-reaching implications, not just for our hospital, but for all hospitals and all healthcare. We're hopeful that because there's been an implementation delay in the most harmful parts of this bill, that we will be able to come together and advocate on behalf of patients who rely on Medicaid to be able to get much of this reversed. The worst effects go into place in 2027 and 2028. And so it's this kind of advocacy that makes all of the difference for hospitals like ours. We're grateful for the support of our community. We're grateful for those patients who trust us to come here for their care. This is a sacred kind of thing that we do here at the hospital, is to be able to provide the highest quality of care regardless of the insurance that people have. And we hope that those who are in power will take a different tack and look for different ways to cover the costs of the budget. We also want to say that this is one of those kinds of situations where when people don't have the care and the coverage that they need for their health care, that they suffer even their own lives. They may not be able to sustain life because they depend on this hospital and they need the coverage that they have in order to be able to access this care. Our hope, our goal, our prayer is that we will be able to continue to be able to offer that care to those important people in our community. And with that, I'll turn it over to Dr. Ellingson, who will speak from a provider perspective.
Hi, good afternoon. My name is Dr. Amy Ellingson, and I've been a rural family physician here in North Central Washington for the past 23 years. Over these last 2 decades, I've cared for thousands of patients, many of whom are your neighbors, coworkers, friends, and family. And I'm here today to speak to you not just as a doctor, but as someone who has seen firsthand the critical role Medicaid plays in keeping Okanogan County healthy and economically stable. When people have health insurance, especially through Medicaid, they are far more likely to seek out regular preventive care. That means catching diabetes before it leads to amputation. It means controlling high blood pressure before it causes a stroke. It means getting treatment for depression or substance use before a crisis lands someone in the ER or worse. The data backs this up. People with Medicaid are 3 to 4 times more likely to receive preventive care than those without insurance. In states like Washington that have expanded Medicaid, we've seen a 9% drop in avoidable ER visits and a significant reduction in uncompensated hospital care, which eases the burden of both hospitals and taxpayers. Medicaid expansion is even tied to lower rates of dying, especially in rural and underserved communities. Along with better health outcomes, access to health care provides an economic boost for the county by keeping people working. When residents are healthy, absenteeism drops and productivity rises. Supporting healthcare jobs, clinics, hospitals, and behavioral health providers are among the largest employers in rural counties. Medicaid reimbursement keeps doors open, supports healthcare jobs, and sustains the rural healthcare workforce that we rely on. It attracts and retains residents. Families and businesses are more likely to move to or stay in our area when we have reliable medical services. In summary, our current Medicaid program improves health outcomes, reduces costly emergency care, draws in new residents, and supports the rural healthcare infrastructure that keeps our communities thriving. Protecting Medicaid isn't just good policy, it's a lifeline for rural communities like ours, and it's essential to the health, strength, and the very future of Okanogan County. Thank you.
Still good? Hi, I'm Joshua Course. I'm the ER Medical Director here at Three Rivers Hospital, and I've been providing rural health care, first as an EMT and paramedic, and now as a physician since 1997. Jefferson's first draft of the Declaration of Independence read that all men are created equal and independent, that from equal creation they derive rights inherent and inalienable, among which is the preservation of life and liberty and the pursuit of happiness. Lately, it seems that everyone in Washington, D.C. has forgotten that paragraph and forgotten rural America as well. Everyone except us. We're here today affirming our dedication to the preservation of life despite the federal government, not because of it. The changes coming threaten our hospital's very existence and the existence of the towns we serve. And it's not just the Medicaid cuts, which affect 38% of our patients and 75% of our children. Every H-2A worker who decides not to travel to our hostile country to pick our apples is one less person to patronize our businesses and use our services. Whenever a farm or small business closes, that's one less source of income and taxes that keep our doors open and our town alive. And when nobody lives here and nobody needs us, we close. And that family, the one that loves our sweeping vistas, our values, and our character, decides not to move to a town with one hospital. That's one less family to keep the town we love young and vibrant. And pretty soon, there's nobody left at all. There's a line I remember from the Hippocratic Oath. I will apply for the benefit of the sick, all measures required. 13 years later, those measures include as much social work as medicine. I'm tired of rationing medicine based on what my patients can afford. I'm tired of watching my patients decide between life-saving treatments and housing. And I'm tired of sleepless nights hoping and praying our hospital finds enough revenue to stay open just a little bit longer. This is not how it's supposed to be in America. It's not how we used to be. To our neighbors and to our friends, we are still here for you. Red, white, blue, or brown, we are here to care for you. Whether you own a mansion, a shack, or just the clothes on your back, we will take care of you. Whether you're from Michoacan or Kingston, we will take care of you. And that will never change. Things we are discussing today are bigger than us, and they will not stand in our way. We will care for you, because all of us deserve preservation of life, liberty, and the pursuit of happiness. Thank you.
I'm Rena Shaver. I'm the Executive Director of Community Action Council here in Okanogan County. And our agency, this is our 60th anniversary of serving the community with food assistance, utility assistance, and housing assistance. We are helping about 1 in 3 of every residence in Okanogan County. So we play a significant role in the well-being of our community. And right now, I'm really concerned about a lot of the proposed cuts and current cuts to some of our programs, including Medicaid. Also at risk is a $20 million grant from the Environmental Protection Agency, which would have funded 2 resiliency hubs for our community. Our utility assistance programs have been eliminated from the President's budget, as has our community service block grant, which leveraged $11 million for our community last year. these are not programs that are, these are programs that provide essential needs for our most vulnerable, low-income community members. And we do not see in my agency waste, fraud, and abuse. I sit right at the front counter, and I see people coming into our office every day who are truly in need of these services to prevent them from becoming homeless, to bridge a gap in some of their earnings, because we don't have a lot of job opportunities here. And I'm very fearful for what's going to happen if all of these cuts go through. And Medicaid is an essential for our community. A lot of our community relies on Medicaid. I believe it's 40% of our adults and 70% of our children are on Medicaid here. These are, healthcare is a basic right, so is food assistance, and when SNAP is cut, we see more community members come to our food banks, food pantries, the 9 food pantries that we support across the county. And those programs continue to be cut, and we don't see additional funding coming in for them. So these are essential programs. People deserve a nice place to live, a roof over their head, food on their table. They deserve to have heat in the winter and cooling. It's 102 today here, so we're all pretty hot. And air conditioning is an essential need here. And those programs are at risk of being cut. So I'm here speaking out saying, you know, to be silent is to be compliant in some of these proposed cuts, and we need this funding. We deserve this funding.
How quickly you forget. Thank you, Rena. I'm David McClay. I'm the CEO of Okanogan Behavioral Healthcare. I'm here to advocate for state-directed payments and maintaining those. In the current bill, the state-directed payments will be rolled back. Community Behavioral Health in Okanogan County has been the beneficiary of state-directed payments of 2%, 7%, and 15% over the last few years. What that's done is allowed us to put 90+% of that into salaries and benefits. And the tangible piece of that is our turnover rate has dropped from 30+% to 9% voluntary turnover rate. And what that means to people in Okanogan County is we can serve more people, we provide better outcomes, we provide better quality service by maintaining the people that we have. So this isn't just theoretical. I sent out an email on Monday telling all of my coworkers that there will be no pay increase this year at Okanogan Behavioral Healthcare. So this has a real impact on who we are and our ability to serve in this community. So thank you. Sorry.
Hi all, my name is Alana Maynard and I'm the Executive Director of Rural People's Voice. Thank you all for coming. We formed this organization 4 years ago as a group of everyday working families from all across North Central Washington. And for generations, we've seen our families contribute what they can but still barely get by, much less plan for our retirement. To win a better future for our kids and for ourselves, we have to come together as a stronger, organized rural voice. A few years ago, my kid was born right here at Three Rivers Hospital, and my family was on Medicaid. We helped call this press conference because rural places like ours can't afford to keep losing the public programs we rely on. And too often, we give them away without pushing back. We get told there's only a small pot, and we have to fight each other for what's inside of it. And when it feels like there's not enough, we get told to blame other poor people, or immigrants, or seniors, or a single parent who's just out there hustling. We've knocked on thousands of doors out here, and we've seen firsthand that the vast majority of rural people want health care for each and every one of us. That means farmers and farm workers, teachers, students. It means our aging parents, brown, white, and black, young and old. We all deserve good health care and a future we can rely on. When Representative Newhouse voted for this bill, he voted to cut our health care, our food benefits, and our housing support. And at the same time, it gave massive tax breaks to some of the wealthiest people in the country. We're here, standing together as working people, with our hospitals and our social service organizations, to say we are tired of barely hanging on. From mobile home parks and apartments, together we sent handwritten letters to Dan Newhouse every day, asking him to stand with us, his people. But this week, he let us down. We deserve a future where all of us have enough to live a good life. We shouldn't have to fight each other over a tiny pot, and we deserve representatives who stand with us instead of the wealthiest corporations and the wealthiest people in the country. We may have lost this fight for Medicaid for now, but this is not our last shot. We're here for the long haul. And we're going to need Representative Newhouse to show up for people who elected him in Okanogan County. This week, that didn't happen. But we're calling on him to show up for us in the future because we're going to need him. So thank you all for coming. Thank you for joining us. We are in this together. You and me and all of our neighbors. We deserve better, and we'll get there together.